The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. My name is Tyron Nixon from the Healthcare Authority. I'm the Tribal MAC Program Manager. Tribal MAC RMTS is the presentation for today. I want to let everyone know that this meeting or this webinar presentation that will begin here shortly is for staff, new staff, that will be training or entering the RMTS here starting actually today. So the following presentation is for Tribal MAC RMTS new staff that will be joining the RMTS. I know earlier a few MAC coordinators had asked if this was something that was for them. By all means, if you would like to stay, you can, or if you have other people, other staff that would like to sit in as a refresher, they are more than welcome to. However, this training is for new MAC staff that have never been in the RMTS before, and they will begin this quarter, April through June. So in the meantime, while we're organizing ourselves, we'll start here in just a few moments. If you're unable to hear me, please let me know. I'm going to ask everyone that we use the chat or question feature in the webinar control panel. So question chat area, if you would take a second or two and just send me a quick message that says that you can hear and that you can see the presentation. And once I have that, we could go ahead and get started. All right, awesome. I see a few of them coming in. Great. Thanks, everyone. Looks like people are able to hear and see us. That's good. Good. Okay, again, my name is Tyron Nixon, Program Manager for Tribal Medicaid Administrative Claiming, or Tribal MAC. And again, this training is for new staff that will be joining the RMTS training for new staff. And before we launch into the webinar for today, there are a couple of housekeeping things I want to get out first or say. Yesterday and this morning, we sent out a couple of handouts to everyone. And I just want to make sure that you receive those. The handouts that we're talking about, number one is the PowerPoint. And the PowerPoint is going to be a document that we will use for today's presentation. Also, you received a participant's manual that is for you after the program or after the webinar is over, something that you can use as a desk manual when you get back to your office. Also, we sent out mobile or instructions and also a quick reference page that will cover some of the important topics that we're going to talk about today. So you should have received 4 items. Number one, the PowerPoint, which we're going to reference today. You also received the participant's manual. That can be served as a desk manual for you when you get back to your office, or I know you're working remotely, but once this presentation is over, you'll have that. And also 2 additional ones, you received a quick reference sheet and instructions on how to use your mobile devices for the RMTS, okay? And I'm looking over here in the questions and chat. It looks like everyone can see us. Great. Okay, so let's go ahead and get started here. Go live dates. The RMTS operates quarterly. And so when we talk about quarterly, when we want to do something new, such as add new people to the random moment time study, those actions take place at the beginning of the quarter, not during the middle of the quarter. So new staff, you're joining on today. So April 1, you see the time up there, but the other times new folks will be able to join will be July 1st, October 1st, and January 1st. So participation in the RMTS begins at these times, and welcome aboard all of the new ones that are all of you new staff who will be joining us in the MAC program. The purpose. The purpose of today, this course is going to provide an overview of the random moment time study methodology and how new staff such as yourself should prepare for participation. Okay, again, this course has provided an overview of the random moment time study methodology and how new staff such as yourself should prepare. Topics. Today, what we're going to do is we're going to cover what Medicaid administrative claiming is, example of MAC activities, MAC facts, what is the random moment time study, the RMTS features, the information you need to answer moments, when do you need to complete a moment. We're going to provide a quick demonstration of the random moment time study to kind of give you a visual of what's to be expected, and also talk about what to expect next. And then we're going to have some questions. One of the things I want to let everyone know, if you happen to have a question anytime throughout this presentation, feel free to do that in the questions or chat log, and we'll make sure that we stop and that we are answering your questions as we go. And also, there's an opportunity after the presentation is over. Feel free to email me, or after this presentation, we'll open up the floor for questions at that time too. Okay, so let's begin. What is Medicaid administrative claiming? Medicaid administrative claiming, we also call MAC, M-A-C, MAC. It's a federal reimbursement program that allows eligible governmental entities such as tribes, such as yourselves, local health jurisdictions, school districts, King County Superior Court, juvenile probation services, governmental entities such as those, the opportunity to receive partial reimbursement for the expenses incurred when staff perform allowable administrative activities. And so, what are those allowable administrative activities? Well, here are some examples of MAC activities. For example, a community health representative explains to a family how Apple Health could help their son or daughter get better access to a specialty doctor. A tribal sister who was not supported by the funding from the health benefit exchange helps a tribal member and her family apply for Apple Health, or a contract health worker refers a tribal member to a specialty health care provider. Those are some examples. And I want to go back to the tribal assister part. The tribal assister is a job title at the tribe. So if your title is tribal assister and you're not receiving funding from the health benefit exchange, that's different. That's something that's eligible and allowable. But if you're being paid out of that pot of money, we want to make sure that we're not double dipping, if you would. A tribal assister, in this case, we're looking at someone who is not supported by funding from the health benefit exchange, helps a tribal member and her or his family apply for Apple Health. Right now, those MAC coordinators that are on the phone, you already know that in order to run this program, a cost allocation has to be in place. A cost allocation plan is a plan that goes to the federal, to our federal partners, CMS, or the Centers for Medicare and Medicaid Services. It lets them know how we're going to operate the MAC program in Washington State. So the news that went out on Monday is that Healthcare Authority, we applied for and went after a temporary amendment to this cost allocation plan in order to extend our activities, especially those activities that are related to the COVID-19 public health pandemic that is occurring right now. And so those public health related activities are surveillance, health education, data reporting, and infection control. And I'm going to say that again. We extended the cap temporarily for COVID-19 public health related activities such as surveillance, health education, data reporting, and infection control. Let's talk about some MAC facts. MAC facts. Number one, the Centers for Medicare and Medicaid Services, CMS, I just mentioned, they're the federal agency that authorizes the MAC program nationally. Healthcare Authority is the single Title 19 Medicaid agency in Washington State that administers the MAC program and is responsible for monitoring all MAC contractors, and the University of Massachusetts Medical School, UMMS or UMASS, that we call it sometimes. They contract with Healthcare Authority for the operation of the time study and for the day-to-day administration of the time study. So between Healthcare Authority, myself, and the University of Massachusetts, we will be contacting you through emails or phone calls to help you through technical assistance problems or resetting passwords. And we may email you occasionally to get clarity about a response, a narrative that you put out. We want to, get clarity to make sure that we're entering in the right information. So when it comes to contacts or communications, you'll usually see something that comes from me, Healthcare Authority, or you will see something that comes from the University of Massachusetts concerning the program. So what is the random moment time study? Well, the random moment time study is a time study where participants receive random moments over each quarter. Random moments over each quarter. A random moment is a 1 minute in time during your normal workday. We're only looking at 1 minute in time during your workday. And when is that 1 minute in time? It's random. You may receive an email asking or letting you know that you have a random moment, and your random moment may be for 9:42, or it may be for 3:03 p.m. It may be even for 4:05 p.m., 4 o'clock p.m. It's random. So that's something that we don't know what's going to occur or when is it going to occur. We just want to let you know that it's random. And that random moment can represent both Medicaid and non-Medicaid activities. So we don't want you, carrying a piece of paper around, any bells or whistles, trying to, be ready for when your Medicaid or non-Medicaid activity happens, or you're trying to store up or get ready for Medicaid activities only. This is for Medicaid and non-Medicaid related activities. So you just go throughout your day business as usual. And we'll talk about how those random moments come to you and what they look like here in just a moment. Some other things about the random moment time study: it provides a statistical valid means of determining what portion of all participants' time is spent performing activities that are reimbursable. So therefore, participants' results that come from the RMTS are used to calculate the quarter MAC reimbursement claim. And so the reimbursement that comes back to the tribe, that's something that the Healthcare Authority, we do not monitor at all. Whatever funds come back to the tribe belongs to the tribe. Whatever way the tribe wants to use those funds, if it's to go into a general fund or whatever way they want to use it, it's up to the tribe. Some of the things that we have seen that have happened in the past with the funds that come through the program, we've seen some tribes use the funds for staff appreciation type of events and activities. We know some tribes have gone out and purchased or got the material to make quilts. We've seen some tribes put in a daycare center or purchase playground equipment for their preschool kids. We've seen some tribes take the money and build office spaces or send people on training. We've even seen some tribes use the funds, the reimbursement, to even hire a staff person. So whatever way that the tribe wants to use the money is completely up to the tribe. HCA does not monitor that. Let's talk about some of the RMTS features. The random moment time study is a claiming system, is web-based. There is an ability for folks who are working remotely like us, the remote ability for answering moments. Staff can answer their moments from any internet-enabled device, such as your mobile phones and tablets. And so I think everybody's on this phone call right now. They're working remotely. So when it's time for you to answer your moments and respond, if you're not at a work computer or using your work computer, you can answer your or respond to your moments through your cell phone. Okay. Some other features. People who participate in the study, you only need to respond to a few 1 minute interval moments over the quarter. And folks, you normally in the system, you would have 5 days to respond to your moments. So you get a moment through your email letting you know that a moment is going to happen, for example, at 11 o'clock today. Normally, I would have 5 days, or you would have 5 days to answer that. But when we did the amendment to the cost allocation plan that I talked about earlier, we have now moved that time to 15 days. So you have 15 work days to respond to your moment. 15 days. And when we talk about 15 days, it's going to be very, very important how you answer your moment, because when we get to this portion, we're going to talk about narratives and documentation. We want to make sure that when you respond to your moment, please make sure that you are writing a narrative whereby it describes the activity that you were performing, and that's going to be very, very important. But we'll talk about that in just a moment. Okay, responding to your moment is fast. It should only take about 1 or 2 minutes to do. If you're starting to see yourself answering your moments in 5 or 10 minutes, that is entirely too long, too long. And we want to know about that. Especially, we want to make sure that the system is running smoothly for you, effectively, efficiently, and quickly. Again, it should only take about 1 or 2 minutes to answer a moment, not a long time to do, not something that's a long to do. How this happens. Participants, you are notified by email when you've been selected to answer a moment, and you respond to a series of 4 questions using drop-down selections. And after those drop-down selections are over with, then you have a chance to write a brief narrative, again, that details the specifics of your activity. So, what information will I need in order to answer our moment? And before we go through this, I'm going to just check our questions chat log right quick to see if anyone has any questions for me. So far, empty, no questions? Okay, good. And still, I just want everyone to know, if you have a question at any time during this presentation, please feel free to go to your chat or questions box and put the question there. So, what information will I need in order to answer my RMTS moment? The information that you'll need answers the following questions. What type of activity were you doing? What were you doing specifically? Why were you performing this activity? And who you were with? That's the information that you will need. So the information is, what type of activity were you doing? What were you doing specifically? Why were you performing this activity, and who you were with? When do I need to complete a moment? You complete a moment during the quarter. Participant moments are randomly chosen throughout the quarter of the calendar year. So July through September, we do this by quarter. You'll be answering moments October through December, January through March, April through June. And so the moments are randomly selected over a quarter. So you may receive a moment or two through per day. You may get 2 moments in a day, 3 moments in a day. Sometimes I think I may see people. I've seen people get 4 in a day. It's probably going to be really rare that you receive much more than that, 9 or 10 or 11 in a day. I haven't seen that, but usually it's been about 2 to 3. I think up to 4. I understand. Just looking at some of the data. So not many moments per day, but then also, because this is random, there may be the possibility that you may not receive a moment at all. So that's something that you want to make sure that if your moment comes, you want to make sure that you answer it, because when we go through the system here, we're going to talk about compliance later on. We need to have 85% of all of our moments answered. 85% is our threshold. So when a moment comes up, remember these are random. So what if it's just two people at your tribe that received a moment? Let's just say Lisa received one, Amanda got another one. But life happens or whatever that's occurring. Maybe Amanda didn't have a chance to answer her moments. Okay, so if those moments expire, then only one person answered their moment, then 50% of the moments were answered. And what is our threshold? This is a chance for someone to get an A. Yep, 85%. If you guess 85%, we need 85% of our moments to be answered. So it's really, really important. So when do I complete a moment? You complete a moment as soon as you get one at the moment. Then there are some other times where you get reminder notices as well. And we'll talk about that a little later. But you get a moment, and then you have 15 work days to answer that moment. But in between those 15 days, there are a couple of reminders or several reminders that go out to you, letting you know that you still have a moment out there that needs to be answered. So let's take this time to look at a demonstration here. I'm going to just end this show here, pause it for a brief moment, no pun intended. Let's take a look at getting into the system. So right now, before we go into the system, all of you should have received an email from UMass already, and it was a welcome email welcoming you to the program. And also in that email, you should have received your user ID. Also, once you get your user ID, it's giving you some instructions to go into the system to establish your password and all of those kind of things. So this is how the login is going to look. Something similar right here. You have your user ID. And this is a training site that I'm in, so I'm going to use this as a demonstration. But I just wanted to point out features of this as I go. You'll notice right here on the right side, you see it looks like a hyperlink is ready, it's open or ready to be entered. It's forgot password. So at any time when you're working, if you forgot your password, you can click here and it works like any other normal banking system, library system, or when you're paying your light or phone bill. If you're online, when you click into reset password or forgot password, you know how they send you a new one back or give you a temporary password so you can go into establish a more permanent one. The same process and system is at play here. So I'm going to go ahead and put in my password. And while the spinning ball is happening, as you see here, is going to get me into the system. While this is happening, I'm going to check our questions and chat log here to see if anyone has a question. And so far, so good. No questions there. Okay, great. Okay, so when the system launches here, there are going to be some key features I want to point out to you. Number one, toward the left, you're going to see the moments. These are all of my moments that are out there. And again, this is a test site. I try not to let my own moments build up like this, but you'll notice they're in order as they come. You'll see 147, 316, 329, 405. These are all randomly put out there. And you'll notice this is the first moment. I got an email that said on March 29th at 147, I have a moment. And over to the right of this, you'll see where it expires. It expires 15 days from this time here. So you'll notice that as well. A couple other features that I want to point out. Over here on the right side, you'll see the same sort of email. Welcome, Tammy Training, as we have here. You've been chosen to participate in the Washington State Random Moment Time Study. Your active moments are listed below, meaning right over here to my left. they will remain active. And this is a testing site, so we didn't put 15 business days. It's normally 5 business days, but right here it's going to be 15. Please click the moment you wish to complete and answer the displayed questions. So we're going to look at that in a moment. But before we go here, I wanted to point out to you, here is an email and a phone number to operators. They are at the University of Massachusetts to provide technical assistance to us. So clicking on here or the number gets you in to help answer your questions. Okay, so now let's choose the top one here. And as we're going into the system, you'll notice the first question. It lets you know this is question 1 of how many questions we have in RMTS? 4. If you guess 4, you are right. You will see right here, Sunday, March 29th, 1:47. What type of activity were you doing? And our responses, I could have been at time off or not at work, whereby I may be on vacation, taking a break. Maybe I'm on sick leave or I'm at lunch. Direct medical services activities. How about financial counseling and claiming? Was I doing any of that work? Was I doing anything around case management or social work, including documenting activities? Was I part of social work or any type of non-medical case management and family intervention? That's one of my choices. Outreach or application assistance, coordinating or referring for services is part of my drop-down selection. Maybe I was doing something around transportation or perhaps training or professional development or operations, some sort of general work duties. But I wanted to point out to everyone, those are our normal drop-down responses. And here, with the amendment to the cost allocation plan, you'll see all of the public health emergency information that was added. So that's toward the middle to the down, to the end of this drop-down selection. You'll notice everything that has to do with the COVID-19 or public health emergency, those questions are here. And they will start with public health emergency. So if your activity, when it asks you a question, what were you doing? If the activity you were doing happens to deal with public health emergency, by all means, here are your selections. But if it didn't have anything to do with the COVID-19 or public health emergency, you have your regular drop downs on the top of that, okay? So let's just choose something here. Let's just say we're going to go with outreach or application assistance for public health. Only thing I do is click into the button, the circle there, and it adds a little button. Then I click next, and this drives me automatically to my second question. What were you doing more specifically? Okay, oops, there we go. What we're doing, let's pick one. Were you working with Washington Health Plan Finder? Were you assisting a client in getting some sort of food stamp or housing or during this public health emergency? Were you doing any type of Medicaid application assistance due to the public health emergency? What were you doing? And so what I'm going to say, we were helping someone to get some housing, some information, some resources for housing. So I'm just going to click there. Then it drives me next. Who were you working with? A client or a family? Or if you don't see anybody that you are working here with, you can write that information in here in the write-in option. So I see a question here. Is client and or family members the only selection? No, that's the only selection that we have here. However, were you working with somebody at DSHS? Maybe you were working with a DSHS social services counselor. You can put that information right here. Okay, who were you working with? I was working with the social services counselor at DSHS. And once you have that, you can go next. Why were you performing this activity? That's question number 4. Why? It was to inform the patient or or to inform my person that I'm working with about some services, or I was explaining a process. So I'm just going to choose the top one here and then go next. Okay, so now this part right here is really, really important. I've answered my 4 questions, and if I forgot what I put down, oh, if you look over here on the right side, you'll see it's been keeping a running tally or running notes for you. The first question, what type of activity were you doing? I said I was doing some public health emergency outreach or application assistance. What were you doing specifically? Oh, providing DSHS information to this person I was working with about child care, housing. Who were you with? I was working with the DSHS social services counselor. And why were you performing this? I said I was informing my patient or my client that I'm working with about DSHS services. So what I would do is come here is to say assisting a client, for example, who is homebound due to quarantine. And do I have spelling amnesty here with access, say to housing resources. So I put that in, and remember, I only have 250 characters, so you don't have to write an entire paragraph, anything. You only have 250 characters here in this box. But you'll notice something. I asked a question, hey, do I get the spelling amnesty today? But I wanted to let you know that this acts just like any Word document that you would be writing. You notice the red lines here to let me know, hey, you done some misspelling or made some errors. And then I could go back here, for example, if this word right here was supposed to be housing resources, I just right click like I would do something similar in a Word document, and you see how it corrects it for me. So assisting a client with, I can go back and make those corrections. So assisting a client, we can say who is homebound due to quarantine with access to housing resources. So, or I could say food resources. So you get the picture. And so we want to make sure assistant client who is homebound due to quarantine with access to food resources, then make sure because of pandemic, we can add that in because we want to make sure that the work that we were doing is connected to the public health emergency. Because of the pandemic, we were assisting a person who is homebound due to quarantine with access to food resources. So I could cut this here. It still works, like I said, any sort of Word document, and make sure that we are putting our narrative in there. Everyone see that? So the next big thing with this here is I put my narrative in there, and then I just click on next, and it drives me to review my final answers. I want to make sure I review and make sure that everything is there correctly, and I have my written response in, and I'm going to click that I certify the answers, and I'm submitting them. And before I even go, the system is asking me, are you sure you want to submit this? Yes, I am. So again, it takes you through pretty deliberately to make sure that we're collecting the right and correct information, and so that we're putting in, the proper narratives and appropriate responses to our day and or to our moment. And I just click yes. One of the things is I go home and I'm done. Then the next thing is it drives me to my next moment. So I'm going to do another couple of moments here, and I just want to point out something to everyone. For example, what if, well, let's just answer this next moment. I'm going to show you about lunch, but I wanted to express something very important about the narratives and documentation, but we'll get to that in just a second here. This one here, what type of activity were you doing? I'm going to say this time I was some time off. at lunch. One of the things we need to know in the system is this paid time off, unpaid time off. For example, is your vacation paid or unpaid? Lunch, is your lunch paid or unpaid? A lot of tribes, everyone does something differently. There are some tribes that have paid lunch. There are some tribes that have unpaid lunch. We just need to know here. So I'm going to say it was a paid lunch. And you're going to notice something here. You notice that my boxes for narratives and things like that are not there. So who are you working with in the narrative box? We don't need to know that information. So I'm going to just click on it's not applicable. It drives me over to the next question. Why were you performing this? We don't need to know why you were on vacation or why you're taking a break. We don't need to know why you're going to lunch. You know, all those things are kind of obvious. And so we don't need to have that there. So it's not applicable. So you don't have to worry about your breaks or your time off having to have an answer for that or to explain that in a narrative. Not at all. Okay. Then I certify as usual and click on submit. And now it drives me to my next moment. A couple of things that are important. Let's look at this moment on 329. So this time, let's pick something. As I click here, it's going to come up. As you see, it's circling there. Okay, what type of activity were you doing? If I put something in by accident, like if it was financial counseling, I didn't mean to do that. I can start over if I want to. Otherwise, I could just come out of this one here and just go normally. I could just touch the button. So I could either start over or just override this button here by clicking into another one. Let's look at transportation. And actually, let's look at transportation normal without public health. Here are my selections. What were you doing, transportation? I'm going to say, hey, we were developing transportation driver schedules. And I go next. Who were you working with? And so you see how the who are you working with expanded a little bit more to alone, a co-worker or tribal staff, drivers, tribal leadership, or I can write in maybe I was working with another vendor, another bus driving entity, for example, or another transportation entity. I can write that in here. But this one I'm going to say I was working with my coworkers. I click next. Why were you performing this activity? Oh, I was scheduling routes. Okay, so now the question is, I was scheduling routes for tribal members to attend, I'm going to say medical visits, for example. Okay, so if I'm doing that, that would be my, for example, my narrative. One thing I want you to write down that's really, really important. Number one, do not put any confidential information into the narrative section here. Don't put any names or do not put any social security numbers in there. So no confidential information goes into the narrative box. A few exceptions. There are some tribes that wanted to use an initial or first initial, last initial, which was fine. Also, there are some tribes that use this to do some other various tracking. And so that's fine too, because those tribes have created fictitious numbers and fictitious sort of identifiers for people. So we don't know who they are. They're strictly confidential. Those kind of exceptions are okay, but we just want to let you know, please do not put any social security number or names or type of identifiers in here into the narrative section. Okay. Also, the next thing I want you to write down, please be professional when you write your narratives, make sure that you're putting down precise information as much as possible, but we want it to be professional because this can be open to your leadership at your tribe. It could be open for monitoring and auditing from CMS, the state, whatever auditors that go through, and you don't want to have anything weird or unprofessional linked to your name. And so try to be professional. If you're out somewhere, if you went on a break, you know, put that you were in a break. You don't have to tell us that were on a break, but we want to make sure that you're using the appropriate drop down. If you're on a break, go up to the top where we showed you before. Use those drop down boxes to put break information in because it doesn't drive you into giving us a narrative. If I've known in the past or seen in the past where people have gone shopping and they put all sorts of explanations down in here, and we don't want that. Again, like I said, we want to be professional as much as possible, and this is not the place to be funny or making any sort of jokes and everything like that. Please put down what you were doing in this narrative box. For example, if you were asked some questions like we have here, what type of activity were you doing? Transportation. What were you doing? Developing transportation, driver schedule, who are you working with, co-workers. Why were you performing this activity? Please do not use the write-in options to say it's my job, those sorts of things, because when the quarter or when you answer your moment, we're monitoring these because the write-in, anytime you're writing in anything, we want to make sure that we collected what you were thinking and we want to put it into the appropriate bucket, if you would, so that staff and so that your tribe is getting appropriate credit, so that we can reimburse properly. So when we ask you a question, we will be primarily asking a question about your narrative. What did you put in this area here? And again, you want to be professional, concise, because we will send an email because we may not understand something, especially if you use an acronym. So we want to make sure that we're understanding what you were meaning when you answered this moment. So again, so that you can get appropriate credit. So with this one, once that's here, you will go on next and certify the moment, and just as normal, you will go forward. So here's the next thing about this RMTS. You remember I said that there are going to be messages. So right here, this is your message center. Right here, you see that I don't have any messages, but if I needed to ask you a question, I will send a message right here. I will send that message over to you and asking you, can you define or explain a little bit more about your moment? Can you tell me what this acronym means? Please send this information in back in timely to us because you still have only 15 days to answer this moment, which is really, really important. And let's see that here. I'll go to my prior moments. You see right here, these are all of the moments that I answered throughout the day or just the past couple of days. And you see how it is. It tells me when it's going to expire. It tells me that I answered them. In this column here, you never want to see something that says expired. It'll be in a whole red color, expired, because once you see expired, we cannot go back and change, add, or alter in any way that moment. We just don't have the ability to. That is now completely locked out. So right now we still have time, because guess what? The moment I just answered, oh my goodness, I just made a mistake on that. That was not about transportation. I was taking a break at that time. So I can go here and change it. I still am within my 15-minute window. Remember, we just answered about transportation. So I'm going to edit this. And what happened was, I remember I was on a break. So I'm going to save my break here, clicking my break. Remember who you were with is not applicable. Well, why I was performing my break, we don't have to put no answer there. It's still non-applicable. I go, click submit. Are you sure you want to answer it that way? I am. And then I'm going to click home, and then it goes to my next moment. Okay. Let's take a moment here to look and see if we have any questions in our chat feature. And it looked like someone did have a question about confidentiality. Yes, definitely. We want to make sure that we don't put any confidential information inside our box there. No social security numbers, no names. Good, good. Any other questions here? Okay, it doesn't look like there are any other questions, but we want to make sure that we are answering these. Again, like I said, here's our message center. We'll normally be sending you messages if we happen to have any questions or if we need some clarity about something that you entered into your narrative box. Okay, so I'm going to come out of here, and when you do get ready to come out of the system here, you'll notice the time off or how to get out of the system is right here where it says log out. It's hidden right behind Tammy Trainer's name. So you want to log out there. And we're using Showwater as an example. As an example tribe. Okay. So we can come out of here and pick back up on our presentation. So we just provided a demonstration there. So the next thing that we want to talk about is what to expect. What should I expect? So right now, again, you have already should have received an email from the University of Massachusetts. Some of you, I understand, have already gone into the system and created a login page. I mean, not a login page, but you've gone ahead and established your password. So how to begin? Register. That would be our first step. You take that email or welcome email, and then you will go in and follow the prompts and the directions that it says. And basically what it's doing is, here's a participant welcome email, for example, and the person that we're using is Robert Baker, for example. In our participant email, it's going to have your name. It's going to give you your user ID. Here is a temporary password to get you into the system so you can establish a more permanent password. And also it tells you where the website is and some other information at the bottom. For security reasons, for the first time, you'll be asked to create a password, and it tells you how many characters this password would need to have, and so forth. That's what your welcome email will look like. Then it takes you to the go to the login screen, as I showed you before. It'll probably put your user ID in there. But if not, you can go ahead and type your user ID in, but mostly it's already pre-populated for you. You will go into the system with your temporary password, and then it will open up the system whereby you can create a more permanent password for yourself. But just a few things about that first page. Look here, it talks about how to reset your password if you need to, instructions for logging in, what to do, and also an email, how you can get in touch with the University of Massachusetts for answering any questions or issues that you may have. Next, this is going to be big, so you may want to write this down. Once you get your registration information and you go into the system, and afterwards you're going to create your password. One major thing that you have to do is to go to the online training. The online training lasts somewhere between 8 and 15 minutes. It is not long at all. At the end of the training, you receive a certificate. And so, excuse me, this is something individually that every staff member will have to do. You only have to do this online training one time a year. So you won't see the online training again until 364 days. So next year at this time, you'll be going through another online training. Again, this is somewhere between 8 and 15 minutes. It's pretty easy to do. Once you're done, it's going to prompt you to press a few buttons so that you can get a certificate. Also, your MAC coordinators and supervisors have access to the system, especially your MAC coordinator. She or he will be able to go into the system and look and see who's completed training, who's answered their first moment, and all those kind of things. So once you get your password and once you get into the system, I suggest that you do your training right away, because you cannot progress or move forward without doing your training. Okay, the training must be done before you can even answer a moment. And so get into the system, do your online training, and once that happens and the certificate process happens, you're able to answer your moment. But otherwise, the system will not let you move forward. Okay, so that's the training link there. Receiving a moment. We showed that a little bit ago about what to do when you first get into the system. You can go ahead and start answering your moments. You'll notice here's a sample email at the moment notification. We're using Robert Baker again, and you will notice here it tells them the time. Uh, his his moment will occur. He has 5 days to do it, but again, that was the normal time. But we are in the amended process or amended cap, so that's 15 days. So this is what your welcome email or at the moment notification will look like. We talked about locating your moments. They will be over to the left side. Like in this example, you can go inside and get your active moments, answer your moment. And the big part again is about the narrative and documentation. Remember, staff must explain how your work activities are related to the activities that you selected in the drop down. So that's really, really important. And staff must explain how work activities are related to the public health emergency. If so, I would say go into the system thinking the activity that I'm asked to respond to, was it COVID related? If it is, then you would answer appropriately or accordingly. You remember the public health emergency drop downs begin at the middle toward the bottom. But if it did not have anything to do with the public health emergency, you would just answer as normal, and those responses are at the top. And again, remember, no confidential information. Here's some sample narrative that you can use. Again, some tribes use some sort of client ID number that they assign to their staff. This is tracking for those tribes specifically. Some use initials, which is fine, like I said, but we try not to use any identifiers, no names, no confidential information. And then make sure that you're answering your moments, and then you're putting in the appropriate narrative again. If it was public health related, emergency related, make sure that we're responding and putting narratives and documenting accordingly. Then certifying your moment. We talked about, the system won't let you complete unless, are you sure? Once you click the button, the box that you're sure and you're certifying your moment. Another thing before we let you go is going to be to talk about or remind you about the compliance requirements we talked about. Remember, 85% of the moments are required to be answered within 15 work days of receipt of the moment, and 15 working days for the public health emergency. Normally it was 5 days, but again, we've amended the cap to allow for 15 days. How this happens, especially for the MAC coordinators and supervisors that are on the phone, are participating in the webinar. 5 days, as we said, is now 15 days. So how this works, the RMTS email notification comes out at the moment. 24 hours after that, new staff, you will get a reminder to let you know that there's a moment out there that needs to be responded to. If you didn't do it at the 24-hour time, meaning if you didn't respond to your moment, you get another after the moment reminder that happens 72 hours after your moment. If you still didn't take any action on that moment, 5 days after the moment, you will get a reminder. Then, if you still haven't done any activities for that moment, 10 days after the moment, you will get a reminder. Also, your supervisor and MAC coordinator will get a reminder to let them know that you have a moment out there that hasn't been responded to. This is very, very important because remember, we don't want any moments to go unanswered. And so, how you can help out here is we know life happens. People may be sick, or you could be on some training, or you could be away out of the office. But when you get back, if you missed your moment, please let your MAC coordinator know, especially if you're gone 5 days. And we're going to talk about that in just a moment. But MAC coordinators, 48 hours before the moment expires, and also new staff, before that moment expires, 48 hours before the expiration, the supervisors and MAC coordinators will get another reminder. Again, if moments go unanswered, they are considered invalid and may jeopardize the statistical validity of the RMTS and reimbursement. And so this is an example of what the reminder email looks like. Again, you get a welcome. Robert Baker, for example, your moment in time occurs at this time. You have this much time to answer it, and it's essential again to answer your moment. But why is this important when we talk about the what's new and also at the moment? If you're away from the office more than 5 consecutive days, make certain that you contact your MAC coordinator or supervisor when you return. Earlier, I had said I sent out some information yesterday and today, and in that information packet to some support documentation, one of the things that went out was a participant manual. On the last page or next to last page of that participant manual, you have a page there that's called change of status. It's a change of status form. Tribes use this form of different ways, or I would say in different ways. Some have this form in the general eating area on a all staff board. Some tribes put this into a shared drive that everybody can get to. This form helps your MAC coordinator and your supervisor because not all staff are in the same building or co-located. There's some staff that are in different buildings. We realize that, and so you don't get to see each other every day. There may be a staff person who's on vacation that has been gone over 5 days, and when you get back, you may have received several moments that go unanswered. And so, what we want you to do, if you're gone over 5 days, contact your MAC coordinator or supervisor with this change of status form or whichever direction that your supervisor or MAC coordinator want you to do or how to reach out to them. But anyway, on this change of status form, lets them know some information about when you were gone, how long you were gone, what was the reason why you were gone. And so the MAC coordinators can go into the system. They have the ability to get into the system to make sure that tribes get credit for the work that has gone on. So if you were off for 5 days because you were sick or you were in training or something and you couldn't get to your moments and you were gone 5 days, 5 consecutive days, they can go into the system and then put those edits in that for example, Andrea, you were missing, or Lisa was on vacation or whatever, and then they can go in to put the appropriate moments or the dates inside of the system so that the tribe is getting appropriate credit. Okay, so change of status form is really, really important. So go live starts today, April 1st, 2020. Welcome aboard, everyone. Again, some of you will start seeing your moments. Some of you may already have received moments. And so we want to make sure that you're into the system and getting what you need to get started. And so my name is Tyron Nixon, program manager here at the Healthcare Authority. There's my contact information, Tyron.Nixon at hca.wa.gov. I'm at 360-725-1894. And so right here, I'm going to open up for questions. Anyone have any questions for me? And if you don't have any questions at this time, that's fine. You may think of something later on. Feel free to reach out to me at that email address, and we'll make sure that we get your questions answered for you. And right now, I'm looking at the questions and chat log. Look like we've answered everything. I don't see any here. Anyone have any questions? Okay, if we don't have any questions, then I'm going to say God bless you to everyone. Be safe out there, and we will talk to you soon. Again, if you happen to have any questions later on that you can't think of now, feel free to send them to me later on. And also, I'm going to let your MAC coordinators know that I'm putting together a questions and answer page that will be out on our website so that you can get to as well. Okay, make it a great rest of the day, everyone. Thank you. Bye-bye.